Faye.
Good evening. We're live on YouTube. I'm Faye D'Souza. Thank you for joining me. We have a very interesting conversation that I'd like to bring to you. Now, we do know, and there's a lot been written about the fact that the Delhi government made a controversial decision over the last 3 days. The government led by Arvind Kejriwal decided that hospitals within the city of Delhi, within the national capital territory, will only treat, both public and private, will only treat citizens of Delhi domicile, which means that they put out a certain list of IDs that you need to have. And if you don't have those IDs and you showed up at the hospital for treatment, you won't get treatment. Now, this caused a lot of concern among citizens. The Delhi government justified it, saying that there are only so many hospital beds we have, and so we have to do something to make sure that the people of Delhi are being serviced by these beds, because the borders are being opened and people are being allowed to come in. Just today, the Lieutenant Governor of Delhi decided to overturn this order by the Delhi government and completely decide that nobody can be turned away from a hospital based on any reason, whether they are residents of Delhi or otherwise. But it does bring us to some important questions that we must ask. Question number one that we have to ask is this: is the decision to limit hospitals only to residents of Delhi legally valid? And the reason why we have to ask this question is even if the LG in Delhi has overturned the decision, other state governments might consider it. We need to look at whether or not this is valid. Secondly, should hospitals be turning patients away at the door at all on humanitarian grounds in the middle of a pandemic, irrespective of where they are residents of? And finally, if there really is a crunch of beds at the hospital, what is the alternative? These are the three questions that we're going to examine one by one through the course of this conversation. And I have a very interesting and a very qualified panel of experts to help us understand this problem. Now, just to remind our viewers, this is not a debate. We don't debate on this show. We actually bring in domain experts to help us understand every angle of a problem so you can make a better decision on your own as a voter and a citizen. Hence, there are no political representatives on my show at all, because I don't need political representatives if it's not a debate. So there aren't two sides to this argument. There's just information. That's what we're doing. So let's take this one by one. Is the decision to limit hospital services only to Delhi residents a legally valid decision? That's my first question. And my guests are Ms. Poonam Muttreja, the Executive Director of the Population Foundation of India. She's a brilliant voice, especially in the matters of humanitarian and in matters of service. Ravi Duggal is a public health activist. Dr. Sanjeev Bagai is the chairman of Nephron Clinic. He's also a much awarded, much respected doctor across the country. Rajni Soren is an advocate who works for the Human Rights Law Network. I welcome all of you to this conversation. And for my viewers, remember, you can pop in and leave us your questions in the comment section of this live YouTube stream. And of course, do remember to use the super chat feature and support me and my team for, support me and my team to do the independent journalism that we're bringing you right now. All right, so let me start with Poonamji. Poonamji, good evening. Do you believe that it is legally valid for the government to have made a decision telling hospitals to turn people away based on their residence?
Well, it's certainly not constitutionally valid, because India guarantees every person the right to life under 21. So for anyone to be turned away from a health facility, and countless judgments we've had of the Supreme Court and many high courts in India, and this has been held to include the right to health. The Delhi government's decision to exclude people residing out of Delhi is a violation of Article 21. The lawyer may have much more to say on this, but I have a very strong position on that. And everyone needs to be treated equally as a citizen of this country rather than a resident of each city. And, even under the Jan Ayog Yojana or Ayushman Bharat, an enrolled person is entitled to seek treatment in any enlisted hospital, public or private, anywhere in the country. So in Delhi, for this to happen, I think is actually a joke. At a time when there's a pandemic, how can Mr. Kejriwal or anybody be even thinking about this? There are pregnant women who are dying, who are not being accepted in hospitals. We do know what's happening, and we want to make it worse. There are Muslims who aren't being accepted. Delhi is a city full of migrants. Delhi is a city where migrants come and other people come every day from the national, not only the NCR region, but far off. If they happen to get critically sick or sick in the middle of the day, are we going to say we won't treat them? And finally, I get the sense that no legal expert was probably consulted. So I don't know who they consulted before making such a big decision. I do know, and Dr. Serene will be able to tell us more about it, perhaps, but I do know that the Medical Association chair of Delhi was chairing the committee that advised Mr. Kejriwal. But how can we have a how can we have a chief minister who's advised by the wrong people? This was clearly a wrong decision. So legally, morally, you just asked me about legally, but morally, ethically, and socially, and if you look at equality, it is absolutely the wrong, and it gives a wrong signal. In fact, it also sends a message of panic to everybody.
Poonamji, one of our viewers has just popped in saying Kejriwal himself travels to Bangalore on a regular basis for whatever treatment he prefers.
Exactly.
How can you have different rules for different people?
I was with Mr. Kejriwal in Jindal once for 12 days. We happened to be there at the same time. So absolutely, good question. How could he have even thought about it? And secondly, like, will he tell Mr. Scindia to go away? I believe sadly, Mr. Scindia is in a hospital in Delhi. Go back to Bhopal, you're not a resident. And secondly, what about all the
Kejriwal himself
stuff?
is from Ghaziabad. So he's taking treatment in Delhi.
So he shouldn't be treated in Delhi. People were asking that question. Of course, I would welcome him and everybody. But also there are migrants, I mean, are you going to tell them to go back? There is such a large slum population, and they will not, even if they're citizens of Delhi, they will not have the paper. So what are you going to do? What are you going to do with all this domestic help, which Mr. Kejriwal and all of us have in our house, who are not residents of Delhi? What will we do with them?
That's a perfect question. Dr. Bagai is with us. Dr. Bagai, don't all doctors take an oath in the beginning of their careers that they will never turn anyone away? Isn't this fundamentally a violation of that promise?
Good evening, everyone. I think instead of dealing with a surge, most of Delhi is now involved in dealing with the politics around it, which was highly avoidable. I think we needed to have done in the last 75 days capacity expansion, unlocking testing, which is still not the appropriate test, and it's still going slow, and mass public screening. We need unrestricted access to healthcare, especially during a pandemic. And please understand that the COVID patients are a very small fraction of the overall disease spectrum. We have almost 90% of non-COVID patients in OPD and IPD, which routinely come, and we cannot take the pulse of that because that is going to hurt us long term. And any unscientific and illogical populism, which is masquerading as leadership, is a classical textbook example of what we should not do. We should never do. We cannot fragment clinical healthcare. We cannot interrupt care of chronic ailments. There are patients which come from very far distances, which come for ongoing treatment on a weekly basis or a bi-weekly basis or a monthly basis. And it's going to create a lot of stress. As it is, COVID has caused stress, anxiety, fear, and depression. The disease itself, as chronic ailments, causes fear and anxiety. And on top of that, we add a lot of chili powder with the unnecessary politics. I think, gagging the doctors in terms of the voice blindfolding the science which we should follow. We bury the vital data and blackmail the cry of suffering public, and we are going to have infinite and unpardonable repercussions of this. I am strongly in favor that healthcare should be for all. It's our constitutional and human right. It's our legal framework which allows us this right. Any patient, be it from any geographic location, any caste, any color, any creed, any socioeconomic condition of any disease, will get the equal platform of equal level of care from any and every doctor across the board, not only in India, but I should say overall globally.
Everyone should have access to medical care. Mr. Duggal is also with us. Mr. Duggal, do you agree that this is an overstepping of the state government's authority here?
Yeah, I mean, I agree completely with what Poonam and Sanjeev have said, and constitutionally, morally, ethically, they can't take such a decision. That's in principle. I mean, I agree with that. And but as Dr. Sanjeev said, I mean, the whole politicization that is taking place around it, I think that needs to be condemned, and that is kind of creating a sour environment, which is already quite sour. And so we need to kind of move away from that kind of thing. Everybody has a right to access treatment anywhere in the country, so that is definitely not on. But I would like to add one issue to this is, I mean, because this is linked to, health is a state subject. So states may turn around and say that, well, it is our domain, and at least where state hospitals are concerned, they would, of course, be violating human rights. But see what is happening. If you look at the development of the health sector, of primary health care, of public health services, there's this theory in political economy and in sociology called center periphery. So the center develops at the cost of the periphery. So the labor comes from the periphery, the raw materials come from the periphery, but the center does not take care of the periphery. So healthcare development, education development doesn't take place in those places. So people are attracted to Delhi, Mumbai, Chennai, Bangalore, wherever. So that creates a problem. And then, so this is not something new. I mean, the Shiv Sena in the past has raised these issues in Mumbai also. That Mumbai is for Mumbaikars, and it's in the 60s and the 70s and so on. So it's not something new. But on the constitutional ground, on the legal framework, I think it's very clear that everybody has a right to get healthcare wherever they are, and nobody can be denied because of their residence and so on and so forth. And we need to move towards that. So if we had a robust primary healthcare system, a good public healthcare system across the country, then you won't face these kind of questions in the first place. Okay, so now Delhi has AIIMS, it has many large public and private hospitals, so people come to that from the periphery. I mean, does Gurgaon have good public health facilities? No, they have a few private hospitals, but public health facilities are very poor. So naturally, people who can't afford private care, they will come to Delhi.
Mr. Duggal, this decision was also made for the private healthcare sector as well in Delhi, saying private healthcare shouldn't accept anyone who is not a citizen, who's not a resident of Delhi.
That probably the government can't decide unless they pass some law or there's an emergency situation, like they use the Epidemic Act to come out with an ordinance.
But can they decide that that public health?
It will not stand. It will not stand in court, because I think in 2018 there was a case of, I think, GTB hospital in Delhi, which refused to take outsiders, and then the court turned it down, and they said no, anybody can be treated in the GTB hospital or whichever hospital it was, one of the Delhi government hospitals. So there has been a court case which the lawyer probably can clarify.
In fact, in all cases, it's been turned down when states tried this, not just in Delhi, anywhere. So in Delhi also it's happened, but all courts, High Court, Supreme Courts have turned down every case.
Yeah, Faye,
yes, please. Let me just approach the next question, and the next question is this. And of course, Mr. Duggal, already brought it up. The fact that there is a severe shortage of beds. Now I'm looking at the dashboard of the Delhi government right now. The Delhi government has put up a dashboard which says it has a total of 8,975 beds, of which 4,800 beds are occupied and the rest are vacant. But it wouldn't seem as if this were true given the stories we've heard over the last week or so of people being turned away from hospitals for lack of hospitals. So what happens in those cases? How do you make sure that the citizens of Delhi have the hospitals they require? Dr. Bagai, you first.
Very quickly, Faye, I think global chronic underfunding of public healthcare has actually ruptured the bastards of the rich and the famous. And literally, it's the first time that you realize that your own good health is directly proportionate to the sickest person in the society, because now it's the public health which is hurting everyone who so far was called as healthy and keeping fit. We know that the healthcare is urban centric. We know that the metros have developed, and this is not something which can be overturned within 2 months of a lockdown with regards building infrastructure. What is important to understand is that almost 75% of Indian healthcare is private driven, be it in major metros or in tier 1 or tier 2 cities. Delhi is a little bit more complex because it has a host of private hospitals, which are basically of two types. One is private, which is built on your own land. And the second is the private hospitals, which have tied up in some sort of relationship, much as intertwined partnership with charitable trust hospitals and land. Then you have state-run hospitals, and then you have the central hospitals. Now, when a patient is sick, it's very difficult for a patient to figure out whether the hospital is state-run or it's government-run or it's a local run. I think what the patient needs is the quickest accessible hospital where a person can reach, especially in crisis, not only in COVID, but otherwise. Now, Delhi overall has, including the private healthcare, it has 57,000 beds, out of which it has 88 large hospitals. It has 1,160 nursing homes, which are registered, and it has about 1,300 dispensaries. So if you remove the dispensaries as a part of the inpatient care, the capacity within Delhi is pretty good as compared to the rest of India. We are still about a million short, 10 lakh short in terms of beds pan-India. But in terms of Delhi, I think the ratio of beds is much better than most parts of India. What in these 75 days a government should have done in Delhi is as follows. It should have networked the amount of capacity beds in a gradual, staggered manner, including the private and the charitable trust hospitals. There has to be a guarantee of a concessional treatment, which is given to the private hospital beds and the charitable hospital beds. As it is, the private hospitals have to do 10% inpatient free. I will go a step further. Some of the charitable trust hospitals have been given land free. Please make no mistake about it. I am not a populist. I am not unrealistic. I'm talking facts. No private healthcare can run for charity free. But if you're given land free, then you have to be given a compliance to the government and compliance to your trust deed. These trust hospitals have to contribute a lot more. They have to give that many number of beds. So I think that internal planning was probably left a lot to be desired. We have that much capacity within Delhi, which would be probably at par with Bombay in terms of healthcare, or in Chennai or in Bangalore. So there is no shortage of beds. What is happening is confusion being created around which bed is available for which category of person, which is geographic based. Totally wrong. We need to allocate beds according to the clinical need of the patient. These beds are there. These beds have to be utilized. Mr. Kejriwal had come on screen a couple of days back and he said things of blackmailing of hospital beds. Whoever is doing it, it's a criminal offense. But I will ask the flip side of the question. Why was it allowed to happen? And it was happening for many, many weeks. It's been circulated all over, not only in print and electronic media, but every social and medical site. Point number two, when you know this is happening, you didn't clamp down. You're calling the hospital owners after 75 days of a lockdown to have a personal meetings. I'm sorry, these meetings should have happened on day 1, day 2, day 5 of the lockdown. This contingency plan, plan A, Plan B and Plan C should have been done much in the beginning. There are 5 Ps. Proper planning prevents poor performance. And we are suffering because we never followed any of these Ps.
Yes. In fact, a statement has just come in right now from the Lieutenant Governor of Delhi, Anil Baijan. He has basically said that the decision violated the right to equality, the right to life, which includes the right to health. When it comes to healthcare, access to universal healthcare is the responsibility of the state. He has said, he has given now an order that all hospitals must admit everyone. And like we pointed out earlier, there should be no discrimination according to the LG on any sort of, patient based on where they live. Ms. Muttreja, it boils down again to the ability to handle this particular crisis. Yes, the borders are being opened. Yes, people are coming back into various cities. And yes, Delhi will have the best possible treatment. And so if someone can afford it, or they can get there in time, or they're already in Delhi, they're going to want to access that treatment. But how should Delhi government handle the lack of beds, the problem of the lack of beds right now?
Okay, so I will agree with Dr. Serene. First of all, why did we have this sudden lockdown where unfortunately...
It's Dr. Bagai.
Dr. Bagai, sorry, Dr. Bagai. We were given 4 hours to close down, which was treacherous for the lockdown, okay? We accepted it, we took it, we didn't scream or shout because we thought that was the time our governments needed to prepare for the pandemic and the numbers as the numbers increase. We were not given any information. Not only was there clearly, now we see no coordination, we were not giving any information how our governments were preparing for the pandemic. Number 2, I would like to take us back. Did we not know that we have a public health system in India, including the capital, with the exception of AIIMS and a few places, which is a totally broken down? Some people say our public health system is in ICU. We knew that. So we needed to put double effort right now in planning, bringing in the experts. Well, countries have done it, and why have the hotels? We thought one reason hotels are being shut is to set up in hotels facilities. You know, in Bilaspur, I remember when 84 women needed critical care after a sterilization camp, they created facilities overnight for extensive care in hospitals and hotels and wherever they could. 2 months into the lockdown, they should have done it. Okay, if they haven't done it, instead of panicking and making decisions which are panic driven, which are going to drive further panic across not just Delhi, in India. One of the biggest problems today to treat COVID is that there is panic. So people are hiding, not going to hospitals. Third, it is possible, absolutely, I believe, even now for the Delhi government to start planning. They need to have a team of people where there are doctors, where there are epidemiologists, where there are scientists, where there are management people. It cannot be political decisions. These are decisions about life and death. So we need to, and then there is the private hospitals. The private hospitals, we've always known there are books and documentaries and documents on how the private sector has done blackmailing when there is need or there is demand, even in other diseases. This is not the first time that we are experiencing this. Every time there are different viruses that come, we experience, not just in Delhi, but many other parts of the country. We know we know the DNA of the private sector. So why can't we put SOPs in place, especially during the pandemic? You can use the National Act, etc., to put things in place. India has some of the best public health and other experts, including management, where they should bring all these professionals in. I haven't heard of a single committee, except this committee that decided, headed, as I said, by a Medical Association of India. where they made this decision to say that only Delhiites will be given a treatment in Delhi. So even now, I would say it's not too late. Let's not make political decisions. Let's not bring politics. I also am uncomfortable if the other political parties are going to jump on the chief minister in Delhi and be critical and put him more in a corner. Support him, work with him. All of us need to work with him. And many of us are happy who are public health experts to work. And I'm sure all your co-panelists would volunteer to do the same. We need a plan for Delhi. We need it immediately. And I am confident we can do it. We can take care, but we have to be transparent. We have to be fair. I want to mention this site. Yesterday I discovered there's this woman who's 9 months pregnant, is going to deliver tomorrow, but she has COVID. She found out yesterday. So obviously they panicked, and we thought nobody will take her through something called CharityBeds.com. On their Twitter handle, we found 2 hospitals, Guru Tegh Bahadur Hospital in Dilshad Garden and Phoenix Hospital. We found that these hospitals, these are charitable hospitals. They have the beds. One of them had 90 extra beds, and they're willing to take a COVID patient who is COVID pregnant mother. We need to have more such proper information out there so that people know where they can go, not just for treatment. Faye, the problem is right now, Delhi is panicky on where to go for a test. The government also, and I believe the Lieutenant Governor is changing it, had said people who are asymptomatic cannot go for tests. They should just wait it out at home. We need for everything testing. We need for treatment. We need for both symptomatic, asymptomatic cases testing. And I hope all this is a good opportunity. We made mistakes, but this is a good opportunity, I think, for the government to have its act together, bring in the best experts, including management. There is a management failure in our health system. And finally, I want to end by saying that we need to invest more money. I've been shouting, screaming, as have people like Ravi and others, that we cannot, what do we expect when you invest 1.3% of your GDP? What do you expect? And this is the capital of India. Our governments have to feel ashamed, and it's not about just Delhi government. It's about our government, our national government too. Sorry.
Well, Mr. Duggal, I want to ask you this. Delhi is, at the end of the day, the seat of power of our country. I mean, every powerful person is in Delhi right now. But unfortunately, the state of affairs, given, I don't know if it's a result of the fact that the state and the central government cannot see eye to eye, if it's a result of just bad investment in the healthcare sector. How has it gotten so bad? The reports we're hearing out of Delhi right now are heart-wrenching. People being turned away from hospitals, people not being given tests, pregnant women not getting the care that they need. How could it have possibly gotten so bad in the national capital?
Yeah, as Poonam said, I mean, there's lack of coordination. I mean, there are beds in central government hospitals and MCD hospitals. And yesterday I heard on one of the channels that the MCD hospitals are not taking COVID patients. So why can't things get organized? I mean, why everything has to be politicized? I think this is because there's a BJP government in the MCD and at the national level. So they don't see eye to eye. Why bring in politics? I think that's one of the things where the coordination doesn't happen, because you tend to politicize. Both sides do it. It's not only that, I mean, Kejriwal is not doing it, but both sides tend to politicize issues. But I think more importantly, I want to add on to what Poonam said, is, this whole lockdown thing, which created the humanitarian crisis, there's a class character to that. Lockdown was done largely to facilitate the middle and upper middle classes, the elite. They stayed at home. They could afford to stay at home. They don't have to go to work. They have their savings. They can manage survival for 3, 4, 5, 6 months without having to get any income, fresh income coming in. But what did it do to the poor?
Yeah.
It created the humanitarian crisis. And I think that is part of the problem, and that we have not been able to actually put the two together. So public health crisis, which have been handled by the healthcare system, turned into a humanitarian crisis, and everything is lost. So for example, I mean, if you look at the entire healthcare system, I mean, it's just collapsed completely. They are not, even if they have beds, they are not able to. They're turning down patients. So all these kind of stories which are coming out, and there's a class character to that. The rich will never be turned
Okay,
away.
so let me ask this
Okay,
question
so the
now
Scindias
to
can
the
get
panel. Yes, let me ask this
beds.
question to the
Yeah.
panel. COVID happened to all the countries in the world. The poor ones, the rich ones, the developed ones, the developing countries. Everybody had the same virus. We were the only ones who had the humanitarian crisis that we had. People dying under trains, people dying in trains, people dying on the roads. India was the only country that reported that sort of a crisis. Our neighbors in South Asia didn't have that crisis. Sub-Saharan Africa didn't have the crisis. The most backward countries you want to blame in the Gulf, in the Middle East, didn't have those crises. Only we did. And if we are now to assume that the whole point of the lockdown was to beef up the healthcare sector so that they're ready to take the rise in cases, now you're telling me that we haven't even done that. So what was the point of this lockdown? If the Delhi government is now going to, today Manish Sisodia says that by the 31st of July, they're expecting 5.5 lakh cases in Delhi with a need of 80,000 beds. They have 8,000 beds right now. If we have not managed to control the number of cases and the community transmission, we completely stabbed the economy in the gut multiple times. We lost life, we lost livelihoods, we've lost human rights. What did we achieve with this lockdown? What was the point of this lockdown? Can anybody see any silver lining in this lockdown? Or is it another demonetization which happened off the cuff with zero benefit for anybody? Dr. Bagai, shaking his head. Dr. Bagai, can you tell me any benefit that came out of the lockdown?
Just to, there are a couple of other points too, but just to answer your question directly on lockdown, I think on medical grounds, on scientific basis, a lockdown is essential in a pandemic. It's the only way you can stop human-to-human transmission.
Okay.
We are in a zone right now in which, of course, we have seen a surge of cases. But don't forget, in a overcrowded and over-urbanized country like India, which is 1.38, reaching 1.39 billion population, with a population density which can hound anyone. It's a horror story in slums. We would have had almost a 50 to 100 times more case fatality. Trust me what I'm saying, if the lockdown didn't happen. I'm not going into the politics of how the lockdown was implemented and what happened during the lockdown, but the lockdown as a concept is absolutely accurate. What is really worrying at the present moment are three facts. Faye, with your permission, if I may say that. Within Delhi, please understand, the most vulnerable and the most fragile part of our society are doctors. Our only weapon is a stethoscope. We work under a lot of stress. We may smile on television, but we work under a lot of stress. We are living away from our families for the last 3 months, including me. We haven't seen our kids in a close distance. We haven't seen our wives. We have not hugged our parents for 3 months. We are worried every patient may be a potential infected patient. It's psychological, mental, extremely stressful situation. Don't put FIRs on doctors. It just betrays the basic trust. It's highlighted and it enhances the distrust between a beautiful relationship of a doctor and patient. It's completely counterproductive. The second thing is we are not doing the appropriate tests. I've mentioned this for the last 3 months. And I got a sore throat mentioning this primarily because we need to do the ELISA test. We are not doing it. I'm not going into the merits of it. And this is in the preview of the program. We have also debated for so long, and finally the LG has given better sense to the Delhi direction that the asymptomatic carriers need to be tested. There is enough international public data, which has been published as recently as 3rd of June in the Annals of Internal Medicine as a 16-country cohort study to show that the asymptomatic carriers are equally potentially lethal to transmit the infection. So there are fundamental flaws which have appeared as cracks. But coming to the real issue is we need to spend more on health. We need to spend a lot more on public health, preventive health. In the end, I would like to mention, we keep talking of 3 A's, Faye and all the panelists, which is affordable. Are we giving affordable care? My answer is no. Are we giving accessible health care? Partly yes, mostly no. Are we giving accredited healthcare? In most parts, at least in non-metros, the answer is no. What do we need to do? We need to make it as personal healthcare, preventive and primary healthcare, predictive healthcare, and it should be transparent healthcare. Otherwise, all these discussions will be in YouTube channels and will be archived in the annals of just discussions. We need a think tank. We need a proper steering committee groups in various parts which report directly to the PMO, bypass all the bureaucratic nonsense. This is the time to be real. We don't need to look good and play to the galleries. This is the time at which we need to act. And I'm talking from my heart. If the pandemic at the present moment has not woken us up, then our eyes will be perpetually wide shut. This is the time which we need to capitalize the momentum.
Ms. Muttreja, I know that you had something to say as well when I asked has lockdown achieved anything.
Yes. So I would like to ask and add a question to your question. Has any country done a lockdown at a 4 hours notice? I don't believe so. We should have, so one is the short notice, so where some planning people who meant to get away could have got away in trains, planes, at least some numbers would have been able to get away. Number two, it is very clear from the government decision that we didn't even think about these millions of migrant workers who are living in, who will lose their jobs overnight with the economy also being shut down. Why did we think about them? They're all over, but we were totally blind to them. Two, suddenly migrants have become, people know there are migrants. Till now, they were just people who worked individually in my factory or in my house or somewhere else. So there is, if there was time given, and even not only when we shut down, but if we had made trains available, like we made planes available for the international people to come, people who were out of India, we could have let them go earlier, and we would not have had them carrying infections. Not all of them, but some of them will naturally carry the infections, and now the infection will go across to the country. Number three, I'd like to say that when the government said people will get, when the Prime Minister really thought by 8 o'clock lecture saying, please pay salaries to your employees and staff, India will follow. And if he made that commitment to Indians, our government should now be holding the people who are not giving salaries, which put a very difficult situation with the migrants. Finally, what Ravi also raised, how do we expect to have social, first of all, social distancing? The word is totally wrong. People could still understand physical distancing. We had our language wrong, but even then, could we not understand it is not possible for the majority of people in Bombay, Delhi, and many other cities to not have any social distance? They live in small houses. They do not have water for washing their hands. So we had to plan for all that immediately. What did we achieve? We achieved in confirming that our public health system is in ICU. We need to invest more and so on. But then when the government announced the package, what did you see on public health? First, nothing. Then they added a little bit, which was expenditures, which in any case, they would have allocated. So public health even now, and finally, I want to address the issue of the doctors. You know, what we have achieved, what we should not have done is creating fear all along. There is a stigma and fear, decisions that have caused further panic, instilling fear against the disease. Fear and panic will only lead to spread of misinformation and stigmatization of those affected by the disease. And I want to say, even now, while our Prime Minister is saying we are making PPEs in India, which we never made before, it's not just, apart from all respect and support to what Dr. Bagai said about the doctors and that very difficult situation, let's also think, at this point, I want to raise the 3.3 million women health workers, which are Ashas, ANMs, and Anganwadi workers, who are working without any protection. Even masks is a rare thing for them to have got. I'm talking about Ashas and Anganwadi workers. There are 3.3 million unprotected women out there who are in the front line, who are managing the healthcare. At this point of time, every healthcare professional, from a doctor to a nurse to the primary healthcare frontline workers, yes, we should be thinking about their protection, because if they are not there, we will not survive. We need to, not only for our survival, but out of respect for they are our warriors right now. And that's how we need to treat them.
All right, I'm going to leave this here at this point, because I think it's been amply clear that the healthcare workers, the doctors, the nurses, the ward boys, the ones who are out there working day after day. Remember, when this started, no one assumed it would go on for this long. I mean, I know how frustrating a lot of you are because you are still at home, but imagine those who have been working non-stop shifts in the hospital. It's physically strenuous, it's emotionally strenuous. It's gone on now for over 3 months. A lot of times,
and it'll go on for 2 years.
Yes. So it's really about now pushing our governments to invest more money in healthcare, to put the safety of our healthcare workers first, and to find ways to do it without violating the right to life of citizens. So I think there's a unanimous decision here or unanimous opinion here that the Delhi government's decision to limit hospitals to only residents of Delhi was in fact completely not okay. The lockdown was meant for governments to prepare healthcare facilities, because even as Dr. Bagai pointed out, that it's managed to bring down cases. Now that you've opened everything up, are we going to go from 2.5 lakh cases to 20 lakh cases? And if that does happen, God forbid, will our healthcare service be prepared? And is the government doing enough to prepare healthcare and to strengthen healthcare services in places that we need it? We might not need it across the country at this point, but Delhi, Mumbai, Bangalore, Chennai, Ahmedabad, for example, these cities are going to need stronger people, or they're going to need reinforcements at the front lines. We need to push our governments to do more to be able to reinforce our healthcare sector. I want to thank our panel, and I want to thank my viewers for coming in. Shefi Vasya, for example, DJ Joey, Love Nature, all of you guys who tuned in today, Joel Arhana, who tunes in on a daily basis. Thank you so much for being part of this conversation. Do pass it on to other people who you think will find use and will benefit from the opinions of my 3 panelists this evening. Thank you for watching. Good night.
Thank you.